Welcome to the Expert Series, brought to you by the Lupus Foundation of America. Today's episode is Childhood Lupus and Mental Health. Up to 20% of people with lupus are diagnosed as children or teens. Developing lupus in childhood can mean more serious disease activity and often overlooked mental health concerns. Today, we are happy to introduce Andrea Knight, pediatric rheumatologist at the Hospital for Sick Children in Toronto, Canada, and Vice Chair of the Lupus Committee with the Childhood Arthritis and Rheumatology Research Alliance. Today, Dr. Knight will speak about childhood lupus and mental health. Thank you, Dr. Knight, for joining us.
Children with lupus are dealing with a complex medical condition that has both physical and emotional challenges. Studies show that emotional health problems are very common. About 1 in 3 youth with lupus have depression or anxiety symptoms, and about 1 in 6 youth with lupus have thoughts of suicide, which is higher than in their healthy peers. And there are several reasons why lupus is particularly hard emotionally. Young patients with lupus require close monitoring and often aggressive treatment, and it can be very stressful to manage multiple medications and appointments at a young age. Many patients experience ongoing fatigue and pain due to lupus, which can limit physical activity, school participation, and social interactions with peers. Children with lupus also may be self-conscious due to visible rashes, or they may feel stigmatized due to their disease, even if not outwardly different in appearance from their peers. Children with lupus often have trouble explaining their relatively rare disease to their friends. These factors can lead to feelings of isolation from their peers. Even when lupus is quiet, patients worry about when the next flare will occur and what impact lupus will have on their future career and family life. As lupus typically strikes patients in their teens, all of these stresses can be very overwhelming, adding to the usual emotional challenges of adolescence. Furthermore, lupus can cause inflammation of the brain in some patients, leading to problems with depression and anxiety. And the medications used to treat lupus, such as steroids, may have effects on both the brain and body appearance, which can also contribute to emotional health problems. Parents of children with lupus may also experience emotional health challenges, such as feelings of fear, uncertainty, and guilt after the diagnosis. It can be very overwhelming to adjust to a new role of medical caretaker for a very complex and uncommon disease. Keeping track of medications and multiple appointments is hard, and having to take time off work or away from other family duties to deal with lupus adds to the stress. Additionally, many experience a heavy financial burden of having a child with a chronic illness. With the unpredictability of lupus flare-ups, parents can feel powerless to help their child while still needing to be strong for their child. And during the late adolescent years, when their child must transition to adult care, parents often struggle with facilitating the need for increased independence of their child to manage their own care. Siblings may also experience difficulty adjusting to a new family dynamic after lupus diagnosis of their brother or sisters. For example, they may not receive the same amount of attention from their parents that they're used to getting. It is difficult for families to balance the needs of a sick child with those of their other children. It can be challenging for parents not to focus all their family interactions on managing their child with lupus and to find time to give siblings their undivided attention. Siblings may feel unable to express their feelings about their brother or sister's lupus and how it affects their life. Sometimes siblings of children with chronic illness like lupus can experience guilt, anxiety, jealousy, or anger. So it's important to assess for mental health challenges in children with lupus and their families. As depression and anxiety are very common in children with lupus, it's important to assess for these conditions routinely, because if left untreated, they can have a very negative impact on the child and the family. We know that children often start to show symptoms of mental health conditions early in the course of their disease, but many are not diagnosed until much later. Even persistent mild symptoms are a predictor of development of major depression and suicidal behavior in later adolescence and adulthood, and therefore these symptoms should be evaluated. Early recognition is key, as symptoms usually worsen over time and such mental health problems can have a negative impact on the child and their family. There can be several reasons why mental health symptoms go undetected. Children experiencing mental health challenges often have difficulty expressing their feelings, as they may be ashamed, confused, and fearful. They may keep their feelings secret from their parents, friends, and doctors. Even if they do feel comfortable sharing their feelings, healthcare providers need to be able to provide accurate assessment of the symptoms. Sometimes symptoms can be overlooked as part of normal adolescent development. So detection rates of depression and anxiety are low in the absence of a systematic approach, and routine mental health screening is important to provide an opportunity for early detection of symptoms. Yet, routine mental health assessment for children with lupus is not currently taking place in the vast majority of pediatric rheumatology settings. Studies indicate this number to be less than 5%. This is notable because children with lupus typically see their rheumatologist several times a year, more than their primary care and other doctors. So routine screening is not the norm, and this is likely contributing to underdiagnosis of depression, anxiety, and other mental health conditions. Fortunately, there are screening tools available for use in children and adolescents with lupus, and there are clinicians and researchers working on developing guidelines for mental health screening for these patients. The goal is to have mental health assessment be a normal part of care for all patients, not just those who are struggling. The idea is to catch things early before they get severe, to be proactive rather than reactive. With assessment, patients can expect some screening questions and then a dialogue with a clinician to put any identified symptoms in context. The clinician would then assess the severity of the symptoms to determine the best course of action, in conversation with the child and family as appropriate. So mental health assessment would be part of the overall lupus care. And it's important to address mental health issues early, as symptoms usually worsen over time. Negative effects of mental health issues such as depression and anxiety can be felt in multiple ways. For example, depression and anxiety can have a negative effect on peer and family and future partner relationships, as well as educational achievement and later employment. Mental health problems can also impact how well patients are able to handle their lupus, as depression and anxiety have been associated with poor adherence to lupus treatment, more clinic and emergency room visits, and less successful transition to adult care. So there are a lot of areas that can be impacted. Once mental health symptoms are detected and the severity is assessed, then a plan can be made to move forward with addressing the issue. There's still a lot of stigma attached to seeking help for mental health issues. And part of the treatment involves educating the child and the family that the mental health problems are common in patients with lupus and that they should not feel alone or ashamed. Depending on the severity of the symptoms, the next steps in treatment can range from follow-up assessment at a next clinic visit to talking with a counselor to referral to a psychologist or a psychiatrist. I think often patients and parents are not aware of the range of mental health treatments available, and the perception is that psychiatric medications are the only options for treatment, and it's not true. In fact, there are several options for talk therapy, which can be really effective treatment for many patients. Additional aspects of therapy can include counseling and coping strategies, peer support programs, healthy lifestyle guidance regarding sleep, diet, and exercise, as well as family therapy and support programs. So there are a lot of options available, and there is hope for children with lupus and their families who are struggling with mental health issues. So I would tell children with lupus who are experiencing emotional health challenges 4 things. The first is to know that mental health conditions are common in young people with lupus. Secondly, you should try to make emotional health a regular part of your health discussion, both at home and when you're at the doctor's office. Third, you should know that there are many options available for mental health treatment that can be tailored to you as an individual for your specific needs. And last, I would advise not to be afraid to get help early, to ask about mental health resources that are available to you at your doctor's office. And besides being open about emotions, to get appropriate assessment and connection to resources, Other coping strategies can also include stress management techniques coupled to regular exercise and getting adequate sleep. And these can have extremely positive effects on well-being. Additionally, participating in support groups with other kids with lupus is also very beneficial to many patients, and it serves as a reminder that you're not alone in the course of lupus and that there are other children just like you.
Thank you, Dr. Knight, for all the great information that you shared today about mental health and childhood lupus. For more resources, we invite you to check out the National Resource Center on Lupus to find helpful tools and guides for childhood lupus. And to connect with others impacted by childhood lupus, you can check out topical conversations at Lupus Connect for parents and teens with lupus. If you or someone you know is struggling, please call the National Suicide Prevention Lifeline at 1-800-273-TALK or text CONNECT to 741-741. We thank you for listening in and are happy to offer this important segment in Spanish next month. Thank you, and have a wonderful day.